So my job is to pick up where the Minister left off. I'm not going to repeat what he said. What I want to do is give you some detail on some of the points that he made to lead us into questions and then discussion later. So the first topic I'm going to start with is the topic of integration and this £3.8 billion fund, and what will it mean for you over not just 15-16 but the preparatory period up to then. But in order to understand the fund and why we have done it in the way we've presented, I think I just need to lay a bit of context. So since 2010, the government has actually injected quite a large amount of additional money into social care. It would be 7.8 billion from 10 to 14. But it went into local authority budgets unring-fenced, or the majority of it unring-fenced. Some of it was transferred via the NHS and was conditioned, but the bulk of it was unring-fenced. And local authorities therefore make their own choices about how to spend that money. And clearly local authorities are facing very serious financial constraints at the present time and are having to make very hard choices. And the consequence of that has been that the amount of spending on adult social care has in reality gone down. So we had to think very hard about putting additional money in 2015-16, because what we don't want as government is to put in money only to see it to leak out into other priorities which are set at local level. But by the same token, we didn't want to straitjacket local authorities by going back to a crude system of ring fencing, which undermines the principle of localism and local democracy. So what we've come up with is this integration fund, and the integration fund will be a mandated Section 75 agreement, which is a joint agreement between the clinical commissioning group on the health side and the local authority on the social care side. And they have to decide together, with the oversight of the Health and Wellbeing Board, how the money is going to be spent within their locality. But we've set some conditions. And I'm not going to go through all those conditions. There are 7 in total, but there are some that are very relevant to you. The first one, and the most relevant, is that the plans that the localities draw up must show how they will protect social services. So they have to demonstrate that within the plan. And that is to make sure that, in part, this money does help to meet the increase in demographic burden in terms of an ageing population, and indeed more young people living longer with severe learning disabilities as well. But a second one, and this is where what the Minister was saying around the relationship between health and care really comes into its own, is that the use of the fund must support coordinated care and coordinated care plans within the community, and also the principle of there being an accountable clinician for each individual who is frail or vulnerable. We've also announced that for those who are over 75, that should be a general practitioner, and that's going to be embedded within the GP contract from April. And we will also put £1 billion of this fund based on results. So it's a payment by results mechanism. And we're finalising the measures, but you will not be surprised to know that they will reflect our desire to move care out of acute settings and, to a certain extent, continue the pathway of reducing unnecessary use of residential care as well, and place more emphasis on providing services within the community. So you can say from everything I've said about the fund that home care providers are absolutely critical to making it work. If we're going to make that shift into higher quality care within the community to stop individuals having crisis episodes and then pulling them through those crisis episodes when they happen so they can sustain life in the community, then the quality of home care is going to be crucial. And therefore, it is really important that every locality is engaging home care providers in developing their plans for the use of the integration fund. And one of the things we will be saying very clearly in the guidance when it comes out in December for drawing up the plans is that we expect to see strong evidence of engagement with providers, both on the health and the care side, in drawing up the plans. The plans will be signed off actually by March 14, that's the plan, a year in advance of the fund actually coming in. The reason for that is because we want areas to get on with putting in place what needs to be put in place in terms of meeting the core conditions, and to also reflect the fact that we will be putting in an extra 200 million through the Section 256 mechanism, which is the NHS funding route, into local government next year. And one of the things we can do is start to use some of the national conditions to work with localities to accelerate their path towards greater integration of services. Integration is a bit of a jargonistic word. We've decided from this point on we're going to call it the Better Care Fund, because that's what it's actually about. It's about coordinated care around the individual not having to tell their story, same story over and over again to different providers, different parts of the health and care system, that the system organises itself around the individual, that we ensure that the third sector is working closely with professionals in terms of the organisation of care within community, that we reach across into other sectors, particularly housing. I think housing associations got a huge role to play in terms of, and also ALMOs and local authority retained landlords, in terms of joining up care and thinking about accommodation needs at the same time. And because of that, one of the things we've done is place Disabled Facilities Grant actually in the Better Care Fund, so that it forces localities to be thinking about issues around adaptations and how accommodation is flexed and utilised as part of the overall approach to coordinated care. So that's what I wanted just to say. One final thing on integration. Other than the fund, there are two other things we're doing. The first is we have launched 14 pioneer areas across the country, of which Leeds, which Sandy is the Director of Adult Social Services for, is one. Because we, having gone through a rigorous process, we recognise that these are areas who are already making significant progress in terms of making this coordinated care a reality within their patch. And you can get all the details on the on our website, but the pioneers range from Cornwall and Torbay and South Devon right up to South Tyneside, from Cheshire down to Kent. There are examples here in London as well. And we're working really intensively with them over the next 9-12 months so that they can exemplify some of the principles that we espouse in terms of good integration. And then finally on integration, it's about removing barriers that prevent this from happening. Some of those are around information sharing and getting the balance right between allowing information sharing and ensuring patient confidentiality or service user confidentiality where that is applicable. It's also about the whole way that we pay for services, and that is about social care and home care, and we've heard about that from the Minister and your chair already. But it's equally true in the health sector, in the fact that there are ways in which payment mechanisms work which actually disincentivise the type of care that we are trying to drive in terms of integration within the community. And so we're having to flex some of those models of payment on the health side as well. So that's integration. Just a few more words on commissioning then. And I just want to start with the comment that the Minister made about the Care Quality Commission and their potential involvement in commissioning. Because if you've been listening carefully, you might have thought, well, isn't there a contradiction with what our chairman said 15 minutes ago when he said that actually we had decided to remove the statutory oversight. And there is a lot of confusion about this, so I just want to give some clarity. There are two powers within the relevant Act, Section 46 and Section 48. Section 46 is the one that we're removing, and proposing to remove, subject to Parliament's decision as the Care Bill goes through the House. What Section 46 was the periodic inspections of local authorities and the potential to rate those authorities as well, and it's that we're removing. What we're retaining is Section 48, which allows the Secretary of State to ask the Care Quality Commission to go into a local authority and carry out a targeted inspection with the potential for further action if we believe that there are good reasons to do so. And that power is remaining, and the Minister is very clear that if necessary, we will use it, because your chair is right. This is about great commissioning as well as great provision, and you've got to have both for the system to work. However, We have already achieved, I think, a huge amount through working in partnership with the Local Government Association and the Director of Adult Social Services. My personal view is that actually peer mechanisms and working on improvement within families of local authorities, with good local authorities working with weaker local authorities, should always be the first and best option. But those powers do exist in extreme circumstances if we really felt that a local authority was failing. I think on that point as well, I would encourage you, and I said this at the ECHA conference a few weeks ago, to be part of the eyes and ears and voice within the system. So if you have evidence and examples of what you think is sustained poor commissioning within a locality, then Sandy would like to know, I know the LGA would like to know, and I would like to know as well, because we can probably do something about it. And knowing early is always the best way forward in terms of being able to work, hopefully collaboratively, with that local authority. There are some great examples of commissioning in parts of the country. We know there are weaker examples as well. What we have to do is bring those that are not at the standard they need to be up to that of the best. And that's why, as the Minister said, we're also working through ADAS to produce this new set of commissioning standards, new toolkit for commissioners to try to improve the consistency of quality of commissioning. And then third and finally, in terms of expanding what the Minister said, I just want to talk a little bit about openness and transparency, and specifically the care quality profiles, the provider profiles that we've established on NHS choices. This is really about the sector, home care and residential care, being able to say in one place, this is what we provide. These are, sort of our key indicators. We also, obviously, on the site on NHS Choices, have the latest regulatory information as well. And I'm really pleased that over 10,000 providers have now registered with the site, and many of those are actually editing their own entries already, placing additional information about their services and using it as a way of reaching out to service users to show, and to potential clients as well, in terms of commissioners, in terms of showing what they provide. And I think if we don't recognise, and this is all of us actually, national government, local government and providers, if we don't recognise the moment post-Francis and post-Winterbourne view about the importance of transparency and openness, then I think we will run a really serious risk reputationally, collectively, from the public. I think we've passed a moment in terms of what the public expect around openness, around core information about services, both at the individual provider level, but also at the locality level as well. And that's something that we have to work through together. So I think that's all I want to say. I just wanted to pick those three topics of integration, commissioning and openness and expand what the Minister said. And I'm happy to take questions, both in terms of what the Minister said and what I've added in the last 10 minutes. Thank you.